Let's talk mallet finger. This is a super common and super annoying problem, especially in Chicago. A finger gets jammed, usually on a 16-inch softball if you're in Chicago, but it could be on a basketball, could be when you're tucking the sheets in to make the bed, something like that. When the finger gets jammed, the tendon that holds the finger up all the way straight rips off the bone back here, and then the finger droops just a little bit, sometimes a lot. That tendon can rip off the bone cleanly or can pull a little fragment of bone off the back of the finger. Either way, they're the same injury. They heal up the same way. It takes about 12 weeks for that tendon to heal back all the way. And we heal these patients without surgery. Typically, we put you in a little splint, holds the finger up straight. You are at full time for 6 weeks and at night for another 6 weeks. If you let the finger droop, clock starts over again. Okay, so for those first 6 weeks, it's very important to follow your therapist's advice. Now, once we pull you out of that splint, you take it off. The splint will irritate you. It'll make the skin just a little red or pink and shiny here. That goes away on its own, but it can take 6 to 12 weeks after the splint is totally stopped for that to happen. Then once everything heals up and you're out of the splint, you will notice the finger typically droops again about a 5 to 10 degrees, but not a substantial droop. This is not functionally important. It is barely cosmetically important, but it's just something to expect. And in the patients who do have the little bone ripped off the back, in addition to the droop, you will have a little bit of a bump here. And that's just sort of the way it heals up. Otherwise, it does not get in your way, doesn't limit your motion, does not meaningfully cause symptomatic arthritis. You heal up and you forget about it. We don't treat these fractures with surgery or these tendon injuries with surgery because the complication rate is astronomically high for reasons that aren't exactly clear. My former partner, Charlie Carroll, has got a great series on this showing about a 40 to 50% complication rate from pinning these injuries. And the complications can be massive. You can get infections of the bone, infections of the joint, the pin can break. It can be really ugly, ugly complications that are way worse than the original problem. So we really try hard to treat these without surgery. So if you do have a mallet finger, come in, get seen. We will get you splinted up and get you on the road to recovery.